And welcome back to the Morning Blend. The HCG diet has been getting a lot of attention lately. Dr. Oz did a whole show on it, interviewing people who've had amazing and very fast results using a pregnancy hormone to help shed pounds. Dr. Deborah Manjoney is here along with Amelia Tollefson, a nurse practitioner from the TransforM Diet and Wellness Center. We also have Katie, who's here. She's currently on the HCG diet. We're going to talk about her results in just a sec. But I think it's a perfect time of year, doctor, to talk about this, because so many people resolve to make changes.
That's right, they do. You know, whether or not you call it a resolution or it's just, okay, I'm going to look at myself now, I'm getting older, I'm turning such and such an age this year, I want to do something more for myself. It's a great time to start thinking about a diet that may really help you, even though you may have failed with so many other attempts.
You know, I feel like I know you well enough to say that you only support things that you think are healthy, that you think are, that you believe in. There are a lot of fad diets out there. This one has the what seems like the makings of a fad diet because it's quick results, it's very restrictive, if you don't mind my saying. But I want to know, as a doctor and someone I respect, how it is that you feel that this is a diet that you can support and supervise.
Well, the diet's been around for a number of years. Dr. Simeon first, talked about this diet back in the 50s after really doing a lot of research for 20 years before he wrote about it and started his own diet clinic. But in addition, I think it's a great alternative for people who have not had success with other things. And I am a bit about alternative medicine. Even though I am a conventional physician, I have been very open-minded throughout my career in looking at choices that may work, that seem very healthy, very safe, and not just ignoring what's out there and what other people are doing, maybe through alternative methods. And so it's something that I have read about for a long time and looked into, and I do feel that it's a very healthy diet. The hormone that's used is used in a very, very tiny quantity, and it's a hormone that is present normally for pregnant women in their first trimester. And so the reason it works and helps is that we're able to have the body metabolize its own fat preferentially and not lose muscle mass as you're going on a very, very low-calorie restrictive diet.
And I'm glad that you mentioned that. In layman's terms, what you're talking about preferentially is the abdominal area, in particular where fat is deposited.
Right.
This diet actually targets that person's area.
It targets the waistline, the heavier thighs, so the areas where you have abnormal fat deposition only. So it's not going to attack the fat in your brain, it's not going to attack the fat that's normally present around organs to help keep them cushioned. It's only going to attack abnormal depositions, down of body fat that's not where you want it.
And that's I think the really good news about this diet and how it works. I want to get to Katie's results because we have some before and after pictures. Congratulations to you, by the way. You've done one 6-round cycle of the HCG diet so far.
6 weeks is about the usual length of time you're on the HCG. So we do with Katie, she was on it in August and September. And Katie, how much weight did you lose then?
I lost 34 pounds and 37 inches.
Whoa, in 6 weeks?
Yep.
Now, everybody's going to want to know as they look at these pictures, and it's so impressive, the areas where you lost fat, Katie. Are those results typical, doctor?
Yes, they are. They're typical. Women will tend to lose a ½ pound or more a day on this diet. Men will lose up to 2 pounds a day on this diet.
A day. I think it's amazing. I know, Amelia, you're part of overseeing the diet. You consult with people. You supervise the program. When people come to you, what are they saying? They're frustrated because they've tried everything?
Absolutely. I think that's one of the biggest things, that they're almost afraid to try because they've failed so many times before. And I think even with Katie, it's amazing the weight loss that they see, and it's so much fun to watch them succeed.
Yeah, I would think so too. And I also think that the fact that it's supervised, that you're checking in with people at the medical clinic, is very reassuring.
And we are investing in them too, because we want them to succeed and to keep that weight off, as opposed to just a fad diet. And how a lot of people have done HCG in the past, where they've done what was called homeopathic HCG. They lost weight, but then they regained it over time. We really want to avoid that, and so that's why Amelia has been very instrumental in making sure that she keeps contact with the patients, helps them to start introducing other foods back into their diet as they come off the HCG, so that they really can establish a good plan for eating. Plus, the HCG diet, what it does, it helps you get off of any food addictions that you have, and get you off of cravings. So people who crave sugar, crave these other things, those are going to be eliminated with this diet. And by the fact that it's at least 6 weeks long, you're getting out of bad habits, because it usually takes about that length of time to get off of those habits.
Yeah. And then there's, I know, a maintenance phase, so you follow
that's
through
right.
with
There's
people.
a maintenance phase. And of course, we're working with Dr. Susan Rieg, who is the physician who prescribes more HCG than anybody else in this state, has had the most experience. And she's with us 2 days a week. And, you know, really has been wonderful in helping us to get to the level where we want to be, and where she is seeing patients over there, and Amelia's working with patients over there to really achieve success.
Yeah, well, congratulations to you, Katie, especially as you start this second cycle of the diet. I think it's great, and I know that people can meet with you, Amelia, or Dr. Rieg at no cost. The consultation does not cost anything to visit with you, see what kind of results you can expect, and see what kind of progress you could make. So here's the information so that you can reach the TransforM Diet and Wellness Center for a free consultation and find out more about the HCG diet. They're located in Pewaukee. You're on Facebook and Twitter, and I know that if people visit you there, that people can actually follow Katie's journey as well, because she's going to be blogging and tweeting. The phone number to call for a consultation is 262-264-5788. Yes. Is that right? Okay. And again, it's the TransforM Diet and Wellness Center. Nice to have you ladies here today. Thank you so much.
Thank you.
Appreciate it.
Great.
Up next